Second white coat. Subscribe and like. Let's learn medicine together.
Today, we're going to dive into the really complex science behind Huntington's disease. It's a condition where, tragically, the brain basically starts to lose its own brakes.
So just think about that for a second. What actually happens when that incredibly complex system controlling your every single move starts to lose its ability to just say stop?
To understand this, let's start with a real-world case. We've got a 52-year-old man. He's living all by himself, and things are starting to fall apart. He's finding it harder and harder to care for himself, and his life, well, it's in disarray. This is where our medical mystery begins.
Now, at first, the signs are so subtle you could easily miss them, right? Maybe even just brush them off. He starts to pull away from friends and family. His hands are a little fidgety. It's nothing that really screams problem, just these little clues that something's not quite right.
But over time, the subtle becomes impossible to ignore. That little fidget, it escalates into these obvious, involuntary, jerky movements in his arms and legs. He starts making these facial grimaces that he just can't control. At this point, you can't deny it anymore. Something is seriously wrong.
And this is absolutely crucial to understand. This isn't just a physical disease. His whole personality is changing. He's becoming depressed, irritable, his thinking is slowing down, he's getting forgetful. We're looking at a complete picture of a system in crisis.
So, you have this absolutely devastating mix of symptoms. How on earth do doctors figure out what's going on? Well, it's time to make a diagnosis and put a name to the culprit.
It turns out this specific combination is what's known as the Classic Triad for Huntington's disease. When you see these three things together, the behavioral and psychiatric changes, the cognitive decline, and those strange dance-like movements, it all points very, very strongly in one direction.
Now, the most unique piece of that puzzle, the thing that really stands out, are the movements. They're called chorea, which actually comes from the Greek word for dance. It's kind of poetic, but also a really tragic way to describe these flowing, uncontrollable motions.
Okay, so we've got a name for it, Huntington's. But what is actually going on inside this man's head? Let's go deep inside the brain and really investigate these broken brakes.
Neurologically speaking, ground zero for Huntington's is a structure deep in the brain called the striatum. That's made up of the caudate nucleus and the putamen. This is where it all starts. This is where the degeneration begins.
So, to get what goes wrong, you first have to understand how it's all supposed to work. Think about your brain's motor control like driving a car. You've got the gas pedal, that's the go signal, the direct pathway that gets movement started, and then you have the brake pedal, the stop signal, or the indirect pathway, which stops unwanted movements. It's a perfectly tuned balance.
In Huntington's disease, that stop signal, the brake pedal, just completely breaks down. The part of the brain that's supposed to be saying, whoa, hold on, don't make that move, starts to die. The brakes are gone.
And this sets off a catastrophic domino effect. It all starts when specific calm-down neurons die off. That weakens the stop pathway. Without that stop signal, another part of the brain, the thalamus, gets way too active. The thalamus then just bombards the motor cortex, basically screaming, go, 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 with no checks and balances. And the result? Chorea, all those extra unwanted movements.
Okay, we've seen the chain reaction, but let's zoom in even closer. What is the key chemical messenger, the neurotransmitter, that's being lost here? It's time for a little neurotransmitter lineup to identify our main suspect.
All right, let's look at our suspects. You've got dopamine. It's tied to movement, sure, but its loss is really the hallmark of Parkinson's, not Huntington's. Then there's acetylcholine, or ASCH. It's also decreased, but it's much more famous for its role in Alzheimer's. And that leaves us with our primary suspect, GABA, which is the brain's main stop, or inhibitory, neurotransmitter. And this chart tells the whole story. You can see GABA and ACH levels have just plummeted. But look at dopamine. It's relatively increased. Now, it's not that the brain is making more of it. It's that with all the inhibitory GABA gone, the normal amount of dopamine has this massive, unopposed effect. And this chemical imbalance doesn't just drive the chorea. That loss of the brain's calm-down signal is also a huge reason for the irritability and psychiatric issues we saw in our patient.
So just how bad is this damage we're talking about? In advanced Huntington's, we can see a staggering 90% loss of these crucial GABA neurons in the striatum. 90%. I mean, with that level of devastation, it's no wonder the brakes fail so catastrophically.
All right, we have covered a ton of ground here, right?
from the first subtle symptoms all the way down to the neurotransmitters. So let's boil it all down into a core blueprint, the absolute key facts that you need to take away from this.
Okay, let's lock in these memory anchors. First, it's a genetic disease passed down through families. In the brain, key areas shrink, what we call atrophy. Clinically, you've got to remember that classic triad: the chorea, the psychiatric changes, and the dementia. And then at the chemical level, the absolute core of the problem is the loss of that inhibitory GABA in the striatum.
And look, if you only remember one single thing from all of this, make it this sentence right here. It connects every single dot for us. Huntington's is the loss of the brain's stop signal neurons, and that loss directly leads to that tragic triad of symptoms that defines the entire disease.